The first startup is Clinica, so I would like to welcome the CEO of Clinica, Mr. Bagshiin, to the stage.
Great. Good morning, everyone. Good evening to people who are joining online. My name is Bagshiin. I represent a startup company called Clinica. So from the very beginning, Clinica wanted to... Clinica wanted to build a service platform. We wanted to build a service platform so that we would shatter the limitation of location and time. So when choosing what kind of service platform that we should build, obviously we had a lot of different categories to choose from. Obviously from ride-hailing to food delivery, all of these categories were pretty much full in Mongolian market. So in a way we chose healthcare. The healthcare market was kind of new for the Mongolian market to the local market. And with our resources, we had two different main advantages. The timing, on June 2020, the pandemic hit the globe. Fortunately, in Mongolian market, we didn't have an in-house case in Mongolia. So that was the first reasoning. The second one, the solution that we wanted to build was first ever. There was no other telemedicine platform in Mongolia at the time. So we have started Clinica in June 2020. So here's the problem that Clinica is trying to solve. Meet Dorj, he's 25 years old. He needed to see a cardiologist in Ulaanbaatar city. This is based on a true story. He's living in Oks province, which is about 1,300 kilometers away from the capital city. And just the travel time alone for him to travel to the capital city is about 1 day. And in order to see a cardiologist, it took him 20 days because of the availability of the doctor or so in the Mongolian healthcare sector. After that, he needed to get these two tests done, blood tests and heart recording tests. To get those tests done, it took him another 2 weeks, and he was referred to a different doctor, known as a rheumatologist, normally known as a joint doctor. And from that joint doctor, he was referred to a different hospital called the Blood Research Center. After going to that Blood Research Center, depending on the availability, it took him another 1 month to get admitted to this hospital. And after getting this admitted to the hospital, took him 5 days, needed to get certain examinations done, took him another 5 days or so. And unfortunately, at the age of 25, he was diagnosed with leukemia. Basically, after staying here in the capital city for 3 months or so to get the accurate diagnosis. And unfortunately, his health has... And there was no room for the hospital, and he needed to wait for another 1 month or so. And he actually passed away after 4 months of trying to get a diagnosis. So what I'm trying to say here is that cases like Mr. Dorj is very common here in Mongolia. It happens to every other individual here in Mongolia. To back that up, WHO has stated that 77% of all deaths in Mongolia were preventable and early detectable diseases. So Clinica is basically made to solve this issue and problem. And in order to get a visit of a 15-minute long doctor visit, customers are faced with a lot of unknowns: which hospital to go to, which doctor to visit. And people who are living in the capital city, they spend up to 3 hours or so just for this 15-minute long doctor visit due to traffic jams and queuing in line. And 1.7 million people who are living in the rural areas, living in the rural areas, they spend up to 1 day just to see the nearest medical health. And oftentimes it's about 80 to 200 kilometers away from them. So we believe that telemedicine is the solution to this problem. Just to see the total addressable market, in Mongolia as a country, we have conducted 17 million visits in 2020. And these visits are categorized into these 5 categories. The telemedicine shows only 0.5% of them. International standard for this telemedicine is about 20% or so. And preventive examination should be around 60%. So there you can see the overall market of the healthcare here in Mongolia. We plan to reach the 20% market share of telemedicine in 3 to 5 years. That's our goal for the 5-year plan. And in solution, we have built a platform that connects customers and doctors. For customers, we provide 24/7 healthcare and access to licensed doctors, and it's going to be easy and affordable. And for the doctor side, we provide much needed income and affordable solution to, Okay, and we provide additional income as well as flexibility of hours of operation for the doctors. Here you can see an overview of our platform. We have the customer side where customers can see their doctors and see their doctor's experience and everything else. For the doctor side, we provide order management system as well as their wages, and we transfer their money, and everything else is operated in the doctor side. For doctor's examination, for Clinica, we face a lot of market issue. A lot of people say, does this telemedicine work and how does this work? Actually, there was a recent study conducted in the United States. So 16 out of 20 doctor exams, so ambulatory visits can be done through telemedicine. So we believe that our solution is capable of solving 16 out of 20 of the market doctor visits. And with the help of JICA, we have partnered with Ministry of Health, and we are implementing our solution to 2 of the biggest national hospitals in Mongolia, First and Third Central Hospital. So all of them are going to be using Clinica. And also we're planning to roll out the nationwide implementation of, nationwide implementation on 3 different products for ICU unit and primary care unit and COVID-19 screening. All of them are ongoing and we're doing it as we speak. Okay, here's our Clinica Timeline. On June 2020, we have done an extensive amount of research talking to government officials, hospital executives, and doctors. We have launched began our development on September 2020 with payment system, order management, virtual visits, and these kind of modules were integrated into our system. We have also did T3D model on November, and we have soft launched our product on April 2020. So our Clinica startup is about 5 months old startup right now. And in July, we have pushed a huge update. On-demand call, primary call, and COVID-19 consultations are free of charge. It's ongoing as we speak. And in 2021, we have 2 major products planned in the horizon. The first one is remote patient monitoring for people who are pregnant, people who need aftercare, surgery aftercare, those kind of things. And second product is the online pharmacy. And just like Ms. Akita said, our platform is going to be bigger and bigger as we speak. Here's our traction. Okay, so far we have 41 doctors in the platform as we speak. We are partnered with 19 hospitals and we have around 11,000 users, and it's all organic. Another interesting thing to note here is that our solution is not only used in Mongolia, we have customers from all around the globe. For example, we have customers from United Arab Emirates, England, Japan, United States. So we have around 280,000 Mongolian people living abroad that have issues to accessing healthcare. So these are our current certain tractions. We have 100% satisfaction rate. Here are certain users review. We have called everyone who have used our telemedicine platform, and we have 100% satisfaction rate. We have 7 different PhDs. We have 7 different PhDs advising us and helping us through, navigate through the medical field. Each of them are operating in the different fields of medicine. And here's our cap table. Currently, our company is valued at $1.25 million. We have competed and participated in certain international tournaments for 1 year or so. Certain tournaments, we have won most of them, and we have placed in top 3 on certain other tournaments as well. Here's our core team. Our core team is we have around 13 people operating right now. Our core team is comprised between IT professionals, marketing and business development and healthcare sectors as we speak. And thank you guys so much. That's all about Clinica. We can move into Q&A now. So sorry, the pointer didn't work, so we have to wait for that time.
Okay, thank you very much. So now let's have the Q&A session. If you guys have any questions, please turn on the mic and ask from the Mr. Ambassador.
Thanks for the great presentation. It was amazing. It's so cool that you are solving these social issues. My question is, can you tell us a little bit about the cost structure from the user's perspective? How much do they have to pay? Is it pay monthly or pay per use? And also probably if you can touch upon the regulatory system to speak about whether this is covered by insurance or not. Yeah, these kind of things.
Sure. So we should probably go. Okay. So there was two questions. The first one was the model and pricing of it. So we do use pay-per-use model. The average doctor visit price is about $12. In Mongolia, it's basically 35,000 MNT. So we use that number as a benchmark. So all of our doctors' prices are kind of vary. So it's about $12 to $18 per visit. So we give the opportunity for users to choose from their financial demand for it. As far as regulations go, in Mongolia, there's a constitutional right that all of the licensed doctors can provide medical advice and products to the service. So we are protected by that law. Recently in the Congress, there's a emergency use for telemedicine service and licenses. It's under development and it's under voting. As we speak, the process has been kind of slow. We're hoping that in 2021, we will get the license once it's available from the government. So thus far, there are no regulations or regulation barriers or law barriers for telemedicine in Mongolia.
Got it. And is the cost covered by insurance or it's out of the pocket?
For Clinica, it's out of the pocket. We are working on getting it covered by the national insurance, by the Mongolian government. Yeah, that's probably going to be done by the next year, we hope.
Got it. Thank you.
Oh, sorry. Can I have a question?
Yes, sure.
Yeah, okay. So in my understanding, getting good doctors is very important for your business. So could you let me know the strategy about how you get the doctors? And if there are any challenges, please let me know.
Sure. So in Mongolia, in the healthcare sector, we have about 54,000 people working in the sector. We have 13,000 licensed doctors operating in Mongolia right now. When we were starting this project, we faced a big challenge. Around March 2021, when we were launching our product, no doctor would want to work with us because they didn't know it would work or not. After we launched our product, as I said in my presentation, we have 41 doctors in our platform. Majority of them, the 80% of our doctors in Clinica have more than 5 and some of them more than 10 years of experience working in the field. And also what I didn't include in the presentation is that we have another 40 doctors on a waiting list as we speak. So we do have a criteria for getting doctors onboarded to our platform. Certain doctors, we have a minimum requirement of 2 years of actual experience on the field. So that's our strategy right now. We don't really have any issue onboarding good doctors or reputable doctors. All of them basically come to us in a way.
Oh, great. Thanks.
Thank you.
May I have some questions?
Yeah.
Thank you very much for your wonderful presentation. So it is great and timely. And so my question is the coverage. So how far you cover geographically all over Mongolia or more centered in the Ulaanbaatar city? And also you had a slide on the global market. So you had already the clients in all over the world in several countries. So is that intentionally you did like that, or you have a strategy or willingness to pursue the global the market? Thank you very much.
Okay, thank you so much, Toru-san. For the global market, that was the plan from the very beginning. As I said, we have 280,000 Mongolians living abroad. Accessing healthcare for them is very difficult. They have documentation issues, language barriers, and financial issues. So we didn't actually market to Mongolians living abroad. They just basically came on their own. They just discovered the service and used our service on their own. So we wanted to pursue them in a way, which was for now it's kind of costly. It's all organic. We haven't really done any mass marketing campaigns. As far as POC goes, it's already done. We have 11,000 users. We have users from around the globe. So it's in the strategy. We don't have any funding to pursue it. It's just gone in organically in a way. What was the first question again?
Geographical coverage within Mongolia. Yes.
Okay. Toru-san, in Mongolia, the 4G LTE coverage is about 70% as far as geographically. So we see that as our market. If you have a smartphone and your area that you're living in has a 4G LTE coverage, we have an open opportunity for them.
Okay, thank you very much. So with this, our Q&A session is over. So thank you, Mr. Vasander. So
Okay. Thank you guys so much.
Our next speech is from Zochil. I would like to welcome the CTO of Zochil, Mr. Rambot, to the stage.